As reported in JAMA Oncology by Kevin Kalinsky, MD, MS, and colleagues, the NCI-MATCH trial's Phase 2 subprotocol EAY131-Y has shown activity of the pan-AKT inhibitor Capivasertib in a range of metastatic tumors with an AKT1 E17K mutation. The NCI-MATCH trial, which opened in 2015, is an initiative that uses genomic testing to evaluate investigational molecularly targeted treatments in patients with disease refractory to standard treatments. The trial includes subprotocols representing nearly 40 single-group Phase 2 trials. Kevin Kalinsky, MD, MS. Kevin Kalinsky, MD, MS. Study details. The Phase 2 trial enrolled 35 evaluable adult patients with an AKT1 E17K-Mutated Metastatic tumor between July 2016 and August 2017 whose disease had progressed on standard treatment. Patients received oral Capivasertib at 480 mg twice daily for 4 days on and 3 days off weekly in 28-day cycles until disease progression or unacceptable toxicity. Among patients with metastatic breast cancer receiving hormone therapy, the dose was 400 mg twice daily. The primary endpoint was objective response rate. The most common cancers included in the trial were breast cancer, N equals 18, 51%, including 15 patients with hormone receptor, HR, positive/HER2 negative disease and 3 with triple negative disease, and gynecologic cancers, N equals 11, 31%. Responses. An objective response was achieved in 10 patients, 28.6%, 95% confidence interval equals 15%, 46%, p.001 vs the null rate of 5%. A confirmed complete response was observed in one patient with endometrioid endometrial adenocarcinoma, who remained on therapy for 35.6 months at last follow-up. Among the 9 patients with a confirmed partial response, 7 had HR positive/HER2 negative breast cancer, 1 had uterine leiomyosarcoma, and 1 had oncocytic carcinoma of the parotid gland. The latter patient had remained on treatment for 28.8 months at last follow-up. The median duration of response was 4.4 months, range equals 3.1 to greater than or equal to 31.7 months. 4 patients were categorized as having stable disease on the basis of missing follow-up scans confirming partial response. An additional 16 patients, 46%, had stable disease. Key points. Objective response was observed in 28.6% of patients. Response was observed in patients with HR positive/HER2 negative breast cancer, endometrioid endometrial adenocarcinoma, uterine leiomyosarcoma, and oncocytic carcinoma of the parotid gland. At median follow-up of 28.4 months, median progression-free survival was 5.5 months, range equals 0 to 35 months, with a 6-month rate of 50%. Median overall survival was 14.5 months. Adverse events. The most common grade 1 or 2 adverse events were diarrhea, 49%, fatigue, 43%, nausea, 37%, proteinuria, 29%, hyperglycemia, 23%, and anorexia, 20%. The most common grade 3 or 4 adverse events, all grade 3, except for one case of grade 4 hyperglycemia, were hyperglycemia, 26%, maculopapular rash, 11%, diarrhea, 9%, and decreased lymphocytes, 9%. Capivasertib was discontinued due to adverse events in 11 patients, 31%, including discontinuation due to hyperglycemia in 3. The investigators concluded, this non-randomized trial found that, in patients with an AKT1 E17K-mutated tumor treated with Capivasertib, a clinically significant objective response rate was achieved, including 1 complete response. Clinically meaningful activity with single-agent Capivasertib was demonstrated in refractory malignant neoplasms, including rare cancers. Dr. Kalinsky, of Winship Cancer Institute at Emory University, is the corresponding author for the JAMA Oncology article. Disclosure: the study was supported by the National Cancer Institute. For full disclosures of the study authors, visit jamanetwork.com.